one of the biggest mistakes, and I actually have a flyer of the 8 key mistakes that people make in innovating, and it's asking BAU to do it. BAU is your performance engine. It's how to go faster, leaner, meaner. Don't even call it an innovation team, because nothing pisses, am I allowed to say that?
Yeah.
Nothing pisses a team off more than being, sort of it intimated that they're not innovative.
What inspired you to make that sort of move into the world of healthcare?
Unfortunately, I'd lost my father when I was in London, and then when I was working at Shaver Shop, I lost my brother. And so it was a tough time, but it just got me really thinking about all the things that I do in business, and how there's got to be a better way to deliver healthcare more effectively. The recruitment agent just said, "I've got a job for you, and it's in healthcare." And I kind of went, "Oh, I'm not, it's not a good time." Then when she said healthcare, I kind of thought, well, maybe it is the time. There are some research studies out there that are showing some of these AI bots are getting as good results in counselling as what humans are. Yeah. But I guess I wonder, are we happy as a society to go everybody down that path, or is it a case of where there is a blended model or more opportunities that should we be, being a little bit more sort of humanistic?
Today we're joined by Jodie Granger, CEO of Healthcare Innovated, a strategic and innovative senior executive with deep experience across the healthcare industry. Jodie has a strong track record of leading large-scale initiatives and transformations, seamlessly connecting strategy with operations to deliver real lasting outcomes. She's made a mark at organisations such as Medibank, WeKo, Tapendium, CSIRO and cohealth. Jodie specialises in digital health innovation with a focus on partnering across the broader health ecosystem to create and deliver new models of healthcare in both health and aged care. From a role as the chair of Women's Circus to senior leadership roles at Disney, she is now a startup founder and mum. Jodie brings a unique and powerful perspective to healthcare transformation. Let's dive into her career journey, her insights into digital health, and what it takes to lead with purpose and impact. Jodie, thank you for joining me today. From researching your career, there's been three themes that really stood out for us that we wanted to unpack with you today. So the first is from Walt Disney to Medibank and healthcare and beyond, and that incredible career that you've built. Secondly, around digital transformation and innovation, sort of what the current trends are, what you're excited about for the future. And then finally, your experience as an entrepreneur and a founder and as a mum, and how that's kind of come together too. But so we'll start with Walt Disney and Medibank and sort of where you are now as a leader in that healthcare space. And I'm going to start with Walt Disney because that's where your LinkedIn begins.
Yes.
So I was interested, is that where it started, or kind of what was going on in your world before then?
Yeah, no. So I started with Woolworths, actually. So I started my career as a trainee accountant at Woolworths in Tasmania, in Launceston. And I went from, a lot of people laugh that I kind of finished university and got a bit of work experience. And then I moved from Launceston to London. And people were like, wow, that's a big move. But yeah, it was fantastic. So I did that. And then I worked in London for a little while at Doc Martens, actually, which again, I was doing accounting. Covent Garden.
Covent Garden, sorry.
Yeah, Covent Garden. It was 6 floors of Doc Martens. And so in the 90s, that was just huge, you can imagine. And 50% off all boots. So I was in heaven. But no, it was from there. And then I got the opportunity to meet with the crew at Disney. And I ended up working in Covent Garden for a lot longer because that's where the Lyceum Theatre was.
Yeah, well, fantastic. So what took you to London from Launceston, or was it just, I need to get away from Tassie? Nothing wrong with Tassie, I should just add.
No.
It's
very much a backpacking. So, I love Australia, but we are a long way for the rest of the world. And I was in my early 20s. And so it was just fun. It was adventure. We travelled a lot. We worked a lot and then travelled where we could. And because obviously London is so close to Europe, we got to see a lot. So travelling was a game changer. You obviously meet people. The context that you get from travelling is, I think, richer than you can ever learn in a book. It shaped my career through not just working obviously at Disney, which was fantastic, but the travel that I got around that time as well.
Yeah, fantastic.
Yeah.
I describe often to people London as the theme park of cities. I feel like around every corner there's an iconic landmark or something you would have seen on television over the years or something. What was your favourite bit about being in London?
Oh, look, I'm a fan of the saying, man who tires of London tires of life. It is, to me, a comfy pair of shoes still. Like, I think... I just think the vibe that London has in terms of it's big, but it's not too big. There's never a shortage of galleries, of theatre, of sport, there's always something to do in London. And obviously it has a big pub culture as well.
Yeah.
And when you're in your 20s, that's where you want to be, beer gardens on a Sunday afternoon.
Yeah.
But it was just the meeting people, the multiculturalism. It was just a fun place to be.
I'd imagine it's quite a shock coming from Tassie to
very much
Covent
so.
Garden. Actually had an office in Covent Garden too. So I spent a lot of time sort of in a similar part of London, and I think it's a real tapestry of cultures and diversity, and you meet tons of interesting people.
Oh, look, interestingly, when I got when I left Disney, which was sort of 4 years after I started, I'd recorded my internal voicemail setting when I first started. And through the years, you obviously update your voicemail, but I'd always done it on the external greeting. I mean, this is back when you had, old-fashioned phones.
Yeah.
I didn't even think about the internal one until the last day that all of my team had set up an amazing kind of celebration. Sad to see me leaving, but they did a kind of big celebratory kind of balloons and, streamers and all the rest of it. And when I came up, I saw the team standing around the telephone just laughing. What are you laughing at? And because I hadn't changed my voice recording for 4 years, and they'd been on at me to learn the Queen's English, you've got to stop speaking so Tasmanian, that they were just playing that initial voicemail greeting, which was very Tasmanian sounding. So they thought that was very funny.
It'd be nice to have a recording of that now.
Yeah. Although they do say when I've gone back there, because I do go back reasonably often, that... They say that I've gone back to speaking. You've lost the Queen's English, the King's English now, but you've gone back to speaking to Australian.
Yeah, great. And what motivated you to go into a career in finance?
Yeah, so I did a commerce degree. I loved. I always knew I wanted to do more commercial, more management, leadership. Yet I kind of wasn't sure, what that looked like. And accounting's just one of those really good, sort of solid basis that you can really, do a lot of things with that knowledge. So I knew it would be a really good foundation. I knew it wasn't what I wanted to do forever, but, I'm still a CPA all these years later. So, it's been good.
Yeah, interesting. And I saw, so when you came back to Australia, I saw you briefly worked at Shaver's Shop. That's actually as hard to say, isn't it? I've never tried to say that before out loud. And then you're a CPA examiner.
Yes.
That's interesting. What drew you to that?
Well, I went from working in the theatre was amazing, and certainly learned a lot about teamwork and collaboration, and we did loads of really fun things. When I came back to Australia, I was offered the role to take it up in Sydney and to open the Lion King in Sydney, but for personal reasons, family reasons, I came back to Melbourne. And consequently, getting a role in theatre was a little bit challenging, so I went to work in property. So it was an interesting role working for Gandil, which is now Colonial First State.
Okay.
Hang on, it's probably changed again, but it went through a few different iterations, but they effectively owned Chadstone and a lot of the big shopping centres. And so from there I went to work for Shaver Shop. So they needed some support. They wanted a growth pathway as a franchise business. And I think from the time that I was there, we grew it from 20-odd to 40-odd stores nationwide. And I think they're at 70 plus now. So yeah, they're doing pretty well.
I had some terrible joke about trimming the bottom line. But,
a dad joke.
That's a dad joke. That is my forte, actually. So then in 2007, you went to Medibank. So what inspired you to make that sort of move into the world of healthcare?
Yeah, so it was interesting timing in that My family, unfortunately, have always suffered from a lot of chronic mental health issues. And so growing up, I'd seen the really poor state of, the health system in terms of the experience, and especially living in Tasmania. If you could get access, when you did, the experience was really poor. The outcomes weren't always great. And so I was always frustrated. Unfortunately, I'd lost my father when I was in London. And then when I was working at Shaver Shop, I lost my brother. Oh. And so it was a tough time, but it just got me really thinking about all the things that I do in business, and how there's got to be a better way to deliver healthcare more effectively. And I got a call not long after my brother passed, and I was actually in Tasmania packing up his things, and the recruitment agent just said, "I've got a job for you, and it's in healthcare." And I kind of went, I'm not, it's not a good time. But then when she said healthcare, I kind of thought, well, maybe it is the time. Maybe there is something here. So that was Health Services Australia, and it was literally a operational management role, looking after business, finance, IT, etc. as well, but largely managing the doctors and nurses and allied health. So very front line. So I learned about health from the front line, and then Medibank, because Health Services Australia were a government business enterprise, they merged with Medibank in, I think it was 2009. Okay. And I then went into a strategy and innovation role. And that was amazing. I kind of really found the ability for me to use that sort of creative side with my commercial business side, creating, new ways to do models of care, new ways to run big procurement contracts like Garrison Health, or chronic disease management programs like we ran Care Complete, which was a number of different programs, disability, Medibank at home, hospital substitution. So just a lot of ways to look at how do we look at healthcare and think about delivering different models of care, which are better experience, better outcomes, and at lower cost. So
what once you got into healthcare, and by the way, it's interesting, isn't it? Because it was kind of opportunistic, but also purposeful at the same time, as in you kind of knew that was something you wanted to go to, and sometimes those moments come along, and I think you need to grab them in life. I think there's I learn a lot by doing this podcast and listening to people's journeys, and it often is about taking those moments. They don't always come at the right time, but being able to see them. So once you got into healthcare, what kind of surprised you about the industry that you didn't know about the industry before you came into it?
Yeah, it's a very good question. I think I was frustrated by some of the inertia, we're just doing it this way, we always have. Yeah. I was full of new ideas and enthusiasm, and, as people that I've been in health now 20 years, and people still come in and they'll come in and have new, fresh ideas, and you see people starting to roll their eyes, oh, here we go. Yeah. But it's getting better. But I think just that, yes, it's more, it has to be more risk averse in many ways, because we're not dealing with widgets, we're dealing with people. I do think, though, that the sort of the mantra of first do no harm has led to being overly maybe risk averse, and I actually like to flip that on its head now and say first do no harm should also include, if there are ways and methods to deliver healthcare to more people and a better outcome, and you're not doing that, then maybe that is harm.
Yeah, interesting. And again, coming, I guess, from, let's say, an entertainment and retail background into healthcare, what did you bring in terms of new ideas and new thinking that you were able to apply?
Yeah, look, I think it was interesting. I think if you think about theatre, it's very team-oriented. Okay, so, I did everything when I was working in theatre. I was the production accountant and then the finance manager, but I also would carry keyboards down to the orchestra pit. I would do welcomings on the big celebrity nights with the red carpet and the welcoming Elton John and, other celebrities. And that teamwork, what I found in healthcare is that there were kind of quite defined roles. So you're a doctor, you do this, you're a nurse, you do this. and perhaps the collaboration wasn't there around the patient or the customer.
Yeah,
and so I think over the years I've definitely seen it improve in terms of multidisciplinary teams and different ways to approach things, but certainly a more integrated, a more team focused approach, so you can use the best out of, if it's digital health, you do get a lot of sort of tech people. They, engaging with more clinical people. Yeah. At Medibank, I brought in the concept for a bit of reverse mentoring. So you'd have doctors or clinicians that were working in the business. They would help mentor some of the usually younger, but less senior digital or customer experience people, and vice versa. So the clinicians got to be, so that reverse mentoring kind of was a way for people to informally, get a feel for there might be a different way to do things.
It's interesting. It made me think about, and I forget who the CIO was, but from one of the universities, and we were talking about his team going and sitting in lectures and experiencing what it's like to be a student and the challenges of getting on the Wi-Fi or the audio or the visual.
Yeah, user-led design all the way.
Absolutely, that's right. As in that's the customer. Yeah. So go and actually experience what it's like to be one of our customers.
Yeah.
And it kind of in some ways sounds similar to what you're saying there with the reverse mentoring.
Yeah.
The other thing that as you were talking, I was thinking about is the comparison between health and theatre. Is that theatre happens in real time. But there's no pause. There's no let's do a second take of that. The show must go on. You have to adapt. You have to evolve. Yes. Sometimes things aren't going to go the way that you want them on stage, but you have to keep rolling. And I guess that's very similar to healthcare, right? There's no
pressure.
playbook.
There can be absolute pressure cooker moments that you've got to, saying that, I remember one of the production guys I was working with, literally somebody got sick right before the show, and we had thousands of people outside the Lyceum Theatre about to having paid, and a lot of excited kids. And one of the understudies was at the pool, which not meant to do, but had gone to the pool because understudies rarely go on. So I think they get a little bit bored sometimes. But literally running down and having to pull him out of the pool and get him dressed and ready for stage. And, similarly in health, it's like, if somebody's not there, your phone's ringing, you've got that kind of pressure of, people need help when they need help, and there is no just, oh, hang on, we'll get back to you. Or like I used to say to the, when we merged when Health Service Australia merged with Medibank, we used to run workplace health clinics, industrial areas. So somebody may have literally cut their arm open and it's bleeding, and somebody comes in to have that done, and all of a sudden we couldn't use the computer, and it was like a computer says no, and it's like no, that can't happen. We need to get him in, and we need to get him sutured up and back to work. So it was different from Medibank too, because they were very much a private health insurer, where we were a health services deliverer. There was quite a lot of cultural nuance and difference there that we had to work through.
Yeah, that's interesting as well, because I guess through that you've joined essentially I'm going to call it a government organisation, and then it's become a private entity. What differences did you experience through that transition?
Look, because we're on the health, I was predominantly on the health services side of delivery. Because we had low margins, and we had to be sustainable on our own, we ran pretty lean. Moving, though, I think there was on the private health insurer side of the business, there was a lot of perhaps inefficiencies and people not running as lean as they definitely not as they would now. So there was quite a bit of change through that. However, I will say George Savides, who was the CEO at the time, did a really good job of. He had a vision of Medibank being always moving to be a health player over a health payer, so he was always investing in how do we become more than a passive payer. So when we moved through that IPO, we were already kind of on that journey. There'd already been a lot of kind of fat, if you like, shedded. There'd already been an investment in healthcare. There was like 3 or 4 different health businesses that had been acquired. So there was already a lot of kind of implementation of the strategy underway. So I think that's probably why Medibank are quite a way advanced now in terms of where they are compared to some of their competitors.
Yeah, great. And I noticed through your career with Medibank, which I'm going to say was probably about 12, 13 years.
14 years.
you had multiple roles. And my reflection on that, which again, I kind of see consistently, is the benefit of working for a large organization is that you can have multiple jobs but under the same roof, right? You don't have to go somewhere else to evolve or adapt, but you still have to create that personal brand and reputation in order to get those opportunities. It's a pretty big topic, but I was just interested, how did you navigate that through your time?
Yeah, it's a good question, and you're right. I mean, working for a big organisation's pros and cons, right? It can definitely create a lot of opportunities, but it can be quite political at times as well. And I've always been very much focused on let's do what we need to for the customer. Let's not worry about who owns it internally, whereas there were some fiefdoms that were more concerned about who owns the work rather than whether the work gets done. I think, my approach was to be very straightforward, if you like, and be very genuine, though, in terms of what are we trying to do, very collaborative. So while I was there, I set up a innovation council. Innovation really struggled to get off the ground because it was happening, but it was happening in pockets and off the side of people's desks. It was happening in a way that wasn't necessarily taking Medibank as fast as it could go because it wasn't, there was no strategy behind it. It was kind of pockets of here and there. And so we created an innovation council. So we had all of the executives or senior leaders from the different parts of the businesses. And we got to decide once a month, what do we want to invest in? And then invest some seed funding, set up some kind of, design thinking type of approaches, build, measure, learn, a portfolio approach to how we want to innovate.
That's interesting.
Yeah.
So it's almost innovation governance, which is almost an oxymoron, isn't it? And it's in some ways that's that phrase. But what as you're talking about that, what's going through my head is the conversations I have at the moment, again with tech leaders, is about AI. Yeah. Right, shadow AI appearing everywhere in the business, and marketing coming in and saying we've got this new gadget, and HR saying, "Oh, we want to do this." Yeah. And AI companies are very, very good at selling into the business as well. Yes. But it sounds like that potentially what you've just described there could be a solution to the current opportunity.
Two answers to that. One, innovation only succeeds with good methodology. So I'm actually going to release a course soon in innovation called Innovate to Lead, to teach leaders some of the key principles around, just an online course, but to teach leaders the principles around good innovation. And it needs a process. So people that, try and let it happen organically. It might be good for employee activation, to have your Thursday afternoon hacks or your more organised hackathons, but rarely does it achieve anything sort of commercially oriented. And good innovation should either, increase your revenue, reduce your cost, create new opportunities. It should do something rather than just be sort of a bit of fun to play around with. So with that, yes, even before AI, since we've been in the digital landscape we're in now, people have been practically drifting around finding new ways, new systems, new tools, and CIOs pulling their hair out going, we've got a spaghetti mess, look at our architecture, it's nuts. And then they'll try and come in and create one like Salesforce or Microsoft. And then, because that's too slow and cumbersome, somebody else will find something lighter that they can just plug and play, and so it becomes that mess again. But that's exactly what the Innovation Council helped with. So we could look at things and say, do we want to invest in that? But not only do we want to invest, don't go out and build a big $3 or $4 million business case with benefits that you are literally making up because you don't know. And very rarely do they ever get assessed post-business case. So we basically created, a way for people to have a prototype. Go out and do an MVP, minimum viable product, or a way to test. I created one called Find, Quote, Book and Pay, which enabled a Medibank member to find a dentist near them, to be able to understand the cost. So if it's a Medibank member's choice network, they'd know what it was going to cost, and then book. And that was the kicker. So we found that time poor mums particularly want to get the most out of their private health insurance, but often they didn't know how, and they just begrudge it because it was a tax tax rebate. So the ability for them then to make a booking directly into the dentist's practice management system at a time that suited them was really popular. And then they'd be able to digitally pay, sort of tap their phone on the way out. And so we took that from a pilot, and they're still running it now. I don't know how well it's going now, but certainly we piloted it. We realised we had 5,000 people come through the booking flow in the first couple of months, which gave us confidence that there was a demand out there rather than going out and spending millions of dollars on it. So little things like that I think help.
It's interesting. I'm going to jump a little bit ahead now to ask my second. Yes. I'm going to come back to healthcare, but I'm going to keep going with this thread if that's okay. And I'm interested in tons with this. So how do you balance innovation with BAU?
It depends on what you're doing and the amount of risk and uncertainty with it. One of the biggest mistakes, and I actually have a flyer of the 8 key mistakes that people make in innovating, and it's asking BAU to do it. BAU is your performance engine. It's how to go faster, leaner, meaner. You need to take last year's results and you need to improve it. Yeah. So if it's in that sort of lane, right, and it might be a little bit of, an adjacency, a better way of doing something, could be optimizing, could be continuous improvement, all very important. But that is within the BAU lane. Once you need to start innovating and test and learn, it's a different skill set. Yeah. It's not to say those people can't do it, but if you're asking them to do it on the same sort of performance metrics, innovation is likely to fail more, right? So you're talking about putting high achievers into roles where they may fail, and that can be really uncomfortable for high achievers. So to get the best people, you need to do it differently, but it needs to be a partnership with the business as opposed to if you take it into a lab, right, and then you try and bring it back into the business, they're like, well, this wasn't built here. It's kind of not my problem. Yeah. Yet if you have a partnership, so you need a dedicated team that can go and do the exploration, the MVP, but be working with the key parts of the business that will open doors. So, where is the sales channel that you might have in the larger business that you can be going out and testing with, or, your membership base or whoever it is, there'll be, but things that are happening in BAU operations, rarely are they going to help what the new innovation is.
Yeah, interesting. Do you know what? You're the best guest ever because I don't have to ask any questions. You instinctively somehow seem to answer.
Sorry, innovation is my passion.
No, that's why we got you on, because I wanted to unpack it. But I'm thinking I'm going to ask this next, and then you answer it, which is amazing. We telepathic. But what I'm hearing then is the discipline and the key skill for a business is to identify and almost segment and say that this is BAU, this is innovation, but you still need to work together. You need to collaborate, because you don't need the BAU guys looking over the fence kind of going, oh God, what's down the pipe?
Exactly.
There's a threat to my job.
Correct. No. And don't even call it an innovation team, because nothing pisses, am I allowed to say that?
Yeah.
Nothing pisses a team off more than being, sort of it intimated that they're not innovative. There's a lot of stuff that happens in BAU, but rather it's a dedicated team that is focused on this small piece until it's like a baby, baby horse, a foal with its kind of wobbly legs, and you've kind of got to wait until it can walk, and then you can start to move it into BAU. So look, I think there is there's always room for both, and it should be in partnership, but being really clear from the outset who's doing what.
That's a couple of things. That's like the scaffold learning metaphor. You come across that?
No.
Zimbardo, I think, psychology model of scaffold. So the idea is when you're teaching someone like a building, you put scaffold around it. Yeah. And over time, as they become more stable and the foundations are stronger, you can start to remove the scaffold till suddenly you have a beautiful building. Yeah. And that's kind of what I'm hearing there, right? In what you're saying.
Totally.
But it's interesting the way you talked about innovation, and you shouldn't label it that. I have the same opinion about change management.
Oh, yes, agreed.
Change manager walks in the room. I'm the change manager. Well, 80% of the room don't like them already. You're not really setting that person up for success.
No.
Why be so obvious in signposting what it's about?
No, I agree. Change is, well, I actually say it's not BAU anymore, it's CAU, it's change as usual. Because we are in an environment we're constantly changing, so don't make it one person's job.
Yeah, 100%. What trends are exciting you at the moment in healthcare?
Oh, well, you mentioned AI. You can't look further. But I think I was actually at the Digital Health Festival 2 weeks ago, and there was some really good debate around where AI fits in. Should it just be low risk, high value, like digital scribes? They're everywhere, and they are adding a lot of value for hospitals and GPs, because they can now sit and look at the patient as opposed to being behind a keyboard typing. So there's obviously, that's at the very kind of low risk end. Then there are obviously diagnostics. So you look at what diagnostics, AI and diagnostics can now, read an image better than humans can. So it's, why wouldn't you use it? Of course, you need a human in the loop, as they say, but diagnostics is huge. And given the ageing population we've got and people's, love of, everyone wants to live as well, not as long as they can, but as quality of life. And so you think about ageing and health are going to intersect more and more as we start to see, obviously a silver tsunami, the ageing population with the chronic disease. I think we're going to see more people being more interested in having more tests. Genomics is becoming so much cheaper. In fact, I think I was at a conference not long ago where they talked about a test that was done 20 years ago in genomics to do a full genomic biome was $1 million.
Wow!
Now you can get the same test done for less than 200.
That's crazy.
So it is. We're gonna know a lot more, and so if we know it, we can do something about it.
Yeah, I read somewhere or heard somewhere recently the average CEO knows more about the metrics of their business than they do about their health metrics.
Yes, probably true.
And that definitely does seem to be a trend at the moment. I was reading about this kind of concept of medicine 3.0, which I'm sure you're very familiar with.
Peter Attica from, he wrote the book...
Outlive.
That's the art and science of longevity. It's great, isn't it?
It really opened my eyes to a lot of things. And just that notion that we've got good as a society at patching people up when something goes wrong, but how do we kind of get ahead of that curve and start to sort of change things? Is that sort of something you're starting to see filter into the industry?
Yes. So there was a couple of sessions last week at the Digital Health Festival on longevity, and really looking at moving from being, in the past it was very male-oriented, very biohacking, kind of, sort of muscly and kind of quite more male-dominated. But what we're seeing now is it's becoming more mainstream. Yeah. So you are getting more females interested. You are, seeing more sort of blood biomarkers and those kind of things being tested, biometric aging. So yes, I think definitely. I think though that there's still, yes, we can get more information, but what we need to do about it often doesn't change that much in terms of exercise, the way we eat, the sleep we get. It all comes back to often a lot of the same patterns. Yeah. But the more we know, the more we can do about it. It's just, I think the what we're doing about it doesn't necessarily change that much.
I think it's the awareness. Yeah. And I think since the advent of the internet, data or information has become abundant. Yeah. And probably we've been figuring out as a human race how to absorb that information and how to apply it. And I think it was Peter Attia actually who talks about this, or maybe I read this somewhere else. But essentially, as a human, you're against it, really, as in you've got corporations spending billions of dollars on producing products and lifestyle choices, and then marketing those products to you. That you're only human, right? Yeah. And that they know how to sell these products to you and how to market these products. And you may know it's the right or wrong thing.
But it's behavioural science as well, the concept of hyperbolic discounting, where you'll say, yes, I want to live healthier for longer, but that's in 20 years. Yet I want to eat this donut and have this wine now, which I know is going to impact my sleep or my health, but I'm still going to have this now.
Yeah, that's right. It's that kind of short term versus the long term. Yeah. It's interesting, actually. I'm going to go back a couple of steps. You mentioned about scribing.
Yes.
About digital scribing. Before Christmas, I had surgery on my hip. Yep. And I went to see the surgeon, and he said, do you mind if I use AI to record this consultation? And I don't mind, as in thanks for checking, go for your life.
They have to, but yes.
And but so we had the conversation and so forth. Anyway, I went back to see him a few months later, and I felt, this is just my interpretation, but from digitally describing it, I don't really feel that he made the same kind of mental memory connection as he would by writing it.
Yeah, okay.
So he had a record of the meeting, but I feel like he was looking at it and then looking at me and trying to remember the conversation. And I think it's one of the things that plays on my mind is I think there is definitely a connection psychologically in your memory systems between a conversation and script. They talk about you remember more what you listen to and write as opposed to what you listen to.
I definitely think about writing. There's a book actually called The Accidental Genius that says, you really get into your subconscious the more you write by hand.
Yeah.
But with typing, I'm not so sure whether it's better if you type or your voice record, but maybe. Yeah, it's a good point.
I don't know the answer to that. Then that's one single experience.
They should be rereading the notes after before you see them again to make sure they were right.
Because he was an awesome surgeon and in his bedside manner and care was fantastic.
No, but it's a very good point, and there's lots we're learning, and we need to continue to kind of go, well, what's the feedback? How did customers feel? Because largely we're hearing that people are okay with it. Some people are okay with it if it's transcription without the actual voice recording. So there's different. We're seeing different things of what people are comfortable with.
Yeah, that fascinating. We could go down a whole rabbit warren around this stuff, couldn't we? What else? What else is kind of keeping you awake at night, good or bad, in health?
Look, I think with AI, I think there is this, the concept of because we can, should we? There's a lot we can do to make healthcare more scalable. And there was an interesting talk at the conference around empathy and around the difference between cognitive empathy and that really meaningful empathy that people get because they are seeing patients and they're building relationships and they've got patterns and they've got recognition from those patterns, and the experience that comes from that. Can AI ever truly replicate that? And so when you've got a lot of mental health applications, there are some research studies out there that are showing some of these AI bots are getting as good results in counselling as what humans are. Yeah. But I guess I wonder, are we happy as a society to go everybody down that path, or is it a case of where there is a blended model or more opportunities that should we be being a little bit more sort of humanistic, in how we allow and design these things. Otherwise, in 30, 40 years, how robotic do we want to become? So that's just the kind of ethical question, I guess, of I'm all for using technology where it makes most sense and we can scale and access for people that didn't have access before. But there definitely is a question of what do we want society to look like once we start really using AI for a lot of healthcare, and especially the line between patient-facing healthcare and behind the scenes, back-of-house healthcare. So I think patient-facing healthcare, we've got a bit more, I think that the question was tabled, would you ever want to get a cancer diagnosis, from AI? Probably not.
Yeah, that's a good question. That's a deep question, isn't it? I think to your point there as well, you see Harvard Business Review putting out that the number one usage now of ChatGPT is for therapy and counselling. And I think that does stimulate a lot of debate because, well, what does that mean? I mean, does that make it more accessible to people? I'd be fascinated to know if there's any gender difference. Yeah. Because I do think that men typically probably struggle more to admit mental health issues and to go and seek advice. Whereas potentially sitting with a laptop and having a conversation may mean that that's more accessible and therefore you'd get better outcomes, you'd hope. But it doesn't detract away from the human to human connection on a deeper level too. So it's a very, very fascinating and hard one to unpack. It
is. And I think, we've got to keep building feedback mechanisms and testing and seeing, well, what impact is it having? And ideally not go too far before we can pull back, where we need to make sure that it's not just human in the loop, but there is a human side to everything that we're doing. We don't want to lose the humanity of it all.
I posted a poll on LinkedIn a couple of weeks ago, which is it was in response to Sam Altman talking about how all the pleases and thank yous are costing him tens of millions of dollars.
That.
Yeah. Where do you sit on that? Do you say please and thank you when you talk to?
I do.
You do?
I even do with Siri. Thanks, Siri.
Do you?
Yes, I do. It's a weird thing, but I do. But I know it costs more. So now that I'm aware of that, I do try and stop.
There goes an environmental cost.
Well, it is, and I saw an article that talked about some kids now that are, when I say kids, so teens, not wanting to use ChatGPT because they're saying, well, this is how much water every request is using. So they're starting to put an environmental overlay on their thinking about when to use ChatGPT. So that's conscious decision making.
Yeah, it's the way that we're informed about this stuff as well. I think I'm not quite sold on saying please and thank you to ChatGPT. I think my flippant comment on LinkedIn is I don't say thank you to my fridge for keeping my milk cold, which is probably a little bit provocative, and it wasn't intended to be. But I think for me, I like to be able to differentiate between what is a computer and what's a robot and what's a human, and it doesn't mean I'm trying to dehumanize the experience, but I kind of recognize the difference between the two. And actually I saw today, I was playing around and I never really looked at the settings for ChatGPT.
Yeah, I don't think I ever have either.
And I was just curious about, because it would actually show you what chats it saves, and you can delete chats from the history you don't want it to save and so forth. But then it had, how would you like me to respond to you? Do you want me to be friendly? Do you want me to be direct? Do you want me to be more inquisitive? So you could actually change the settings, instruct it in what kind of experience you're looking for, which I had no idea till today. That was
They're just coming out. In fact, when I was at the conference, I mean, I love, people say to me, what's your favourite tool? And I said, I always use ChatGPT, paid version, just, because I can put images in it or OCR, and it's just super easy. But somebody suggested Claude the other day, and if you've tried that one, but that was amazing. Just the free version, the empathy that it gave. I asked it to write me an article on something, and I was like, wow. When you get that is scarily, like I said, put it in this tone, et cetera. And there was very little that I would change about it if I'd written it. It's
pretty incredible, isn't it? It's so actually, someone told me recently to ask ChatGPT if you use it fairly often in the paper, ask it what it knows about you. Without searching the internet, just based on your conversations. It's quite incredible. The depth of things it would already have deciphered based on what you've told it.
That's right. It's
but that's its job. That's what it's designed to do. You shouldn't be surprised by those things. If you could, this may be a big question, but if you could wave a magic wand and fix one thing in healthcare with innovation, what would it be?
Oh, it would probably be one of the most basic things that we should have solved a long time ago, called interoperability. So if you go to one hospital, you can have your health information, in your hand, or from whatever device, whatever hospital, whatever GP, allied health, all of that information should be available to you when and where you need it. Now, the government are working to that, so they've mandated diagnostics be uploaded and you get access to that. But there's other information. The amount of time I go to a GP or other specialists and I say, is that going into my health record? And they'll look at me strangely. Or and it's been hard for them because it's been a PDF storage, Dropbox, as opposed to a proper interoperable. I'm Jodie. My identifier is, 1, 2, 3. These are my conditions. These are my medications. Yes, with the right privacy and safety. A lot of people, the concerns about, the information and interoperability. Well, what if my insurer gets it? Well, actually, in Australia, that doesn't matter because we're community rated. But they wouldn't anyway. There's rules around it. But so I think that there's a lot of misinformation out there around what would happen if all of your healthcare information. Well, what if my employer was to see it? Well, no, we're not saying that could happen. It's to enable your physicians. Often they don't know. I had an indication, and a doctor said it was only the last minute that the doctor said to me, "Oh, are you on that medication as well?" And I said, "Yeah." And she said, "Oh, well, that's contraindicated." And that was literally right at the end. I was about to walk out. So, not having all of that information in one place, it just creates a lot more issue across the healthcare. I
think it was Peter Attia or maybe Gary Brecker I read talking about this, and he worked as an actuary.
Yes,
And
Gary, I
it's
think
Gary,
that is,
and,
yes.
he was talking about how, as an actuary, it's quite frightening that he could predict almost to the month people's life expectancy and then paid a bonus on his success rate, which is awful. But he would see medications that people were on from different physicians and see that they are going to cause a problem, but under data protection couldn't do anything about that, which led him into his line of work where he is now. But
he's coming to Australia actually.
I just bought tickets actually.
Yeah, we're going to. But no, I agree, and that's why they say when people say there's no money in health, there is a stat that says it's actually 60-30-10. 60% of care is effective, 30% is waste, and 10% is harm. So that's a rudimentary not even rule of thumb, but the stats. But that 30%, how many double scans, wrong medications, unnecessary hospitalisations. There's so much there that if we get primary health and preventative care right, we'll stop the ambulance at the bottom of the cliff.
So it sounds relatively straightforward that everybody has a medical record and everything aligns to that, but seemingly that's not the case.
No, look, the government, they're working on fire standards through a program called Spark. And we're getting closer to it, all providers, but the government didn't mandate it years ago that all providers had to capture information, or system providers had to capture information in a similar way. So, or with sort of standard protocol. And that's changing now, but it's going to take a while. Health, as I said, it's hard. GPs quite rightly have been concerned about information being displayed or disclosed to their patients too early. So there's things like 7 day before you can get your imaging reports. You have to wait 7 days. Right. Gives you the opportunity for your doctor to speak to you first. Again, information symmetry is getting better, but doctors still have a upper hand, and you always want them to have an upper hand. They understand things that we should be going to them for and trusting them with. But that information in our hands can then be, after I'd seen the doctor, my physio wasn't sure about something the doctor had put in the notes. And I said, well, hang on a minute. And I opened my phone and brought up the image of my MRI. And he's like, oh, yeah, that makes sense. So that's stopped the need for me to phone the GP. The GP's busy to go back to the physio. The physio's busy. Yeah. So it's just little things that can take a lot of waste out of the system.
Yeah, absolutely. And again, going through my hip situation, I experienced exactly that, except sadly I'd take away every sentence and put it into Google and scare myself to death, which probably isn't healthy either. But we've kind of touched on government there a few times, and we've obviously just come through the federal election. And politics aside, my kind of take is that we're going to see at least 6 years, maybe 9 years now of a Labour government. That gives us some consistency and a chance for reform and change, and not someone that's looking over their shoulder thinking, I'm going to lose my job in 3 years if I don't go with the popular choice here. So I'm hoping that we're going to see some real significant difference here in Australia. What are you kind of hoping for from a healthcare perspective?
I think Mark Butler's done a pretty good job. He's very big on the digital health. You'll hear him talk a lot about his disdain of faxes, which still do exist in healthcare today. I think he will push that interoperability. I think he will also put more pressure on. Medicare is the biggest funder. So the government's the biggest funder of healthcare. Next, customers, out of pockets, and then private health. I think that there needs to be some way of integrating health and aged care more. And I think having the portfolios come under him, or come under that ministry now of disability, aged care and health care coming together rather than it being siloed, creates a lot of opportunity. I think, things like home care, most people want to, they want to heal at home, they want to die at home, and the home is such an important place where people can be treated. And not everyone, but certainly virtually. And we still have a politicians love cutting ribbons in front of big hospitals kind of mentality. Even the Victorian government last week, out of $11 billion, they've announced I think $9 billion is for hospitals. So again, it's still very much hospital, which is tertiary health centric. I think we need to get in front of it. We need to look at different models of care. but there needs to be some funding reforms for that to be possible, and hopefully they will be open to that. There are some pretty strong, advocacy groups in health that make change hard, and hopefully we can find, given we can't open enough hospitals or open enough aged care facilities for the rate that we're facing into in the next 20 years. So needs must. We need to do things differently. Yeah. I think the way we were brave and invested in superannuation many years ago, hopefully we can do something similar and be a bit braver in terms of the funding reform in healthcare.
Yeah, great. Yeah. Okay. I'm going to move along a little bit, if that's okay. I'm going to talk about you as a founder, a mum-entrepreneur, I think is the phrase. Do you like that label?
Yeah, I don't dislike it.
Yeah, okay. My wife has her own business and she hates that label.
Well, as long as you get dadtrepreneur as well.
Well, that's
so
right.
That's the agenda. We don't want people to go, oh, a woman's doing her own thing. Oh, look at her go. Well done.
Well, that's what I mean. It's a bit patronising, isn't it?
So I guess that element is probably not so good.
Yeah, but you're a business owner, CEO of your business Healthcare Innovated.
Yes.
A mum of 2, 6 and 8. I bet that keeps your hands full.
Sure does. And now a puppy.
There you go. It doesn't even on my list. I was going to say, and you recently a tech startup founder.
Yes.
So it all sounds very glamorous and exciting. Is it? Is that the reality? How do you make it work?
Look, I love what I do, and I wouldn't do it any other way. But yeah, it's tricky. I think you've got to have your boundaries. You've got to have good time management in terms of and really focusing on your what's really important to you. Yeah. Put your why in front of what. So that's kind of a bit of a mantra that I always live by. Why, and then what do I want to achieve, and then how am I going to do that? I think, I love that my daughters see. In fact, I'm usually there to pick them up from school. Either my partner or I, we kind of make sure that we are very active, but they still say, if I pick up the laptop at 5 o'clock, they'll say, "Are you working again?" Yeah. And it's trying to teach them that this is flexible working, whereas back in the day they would have seen mum or dad go off at to work at 9, and they'll probably be in care and they'll get home at 5, whereas I get up at 5:30 and I work before, and then we've got the morning routine, and then they go to school and I work, and then we pick them up, do swimming, and then I put them to bed, and then I might work. So it's just having that. It's different, it's flexible. They'll always want more of your attention than they can get sometimes, but I think it's I do love it.
I think there's something powerful as well about your children seeing what you do for work and experiencing it firsthand. I grew up in a family of self-employed people. I always joke I'm the only person in my family to have a job. It doesn't mean they're unemployed. But I sat with my dad and we'd count his takings at the end of the week on the carpet, and I understood, I guess, the value of currency and cash very young. And I think that's something I've kind of carried into my working career. And my wife and I often talk about this, where the kids are always interested in what we do at work, and they see my wife working and they'll see me working from home as well. And I think that's just important, that they don't just think that we, miraculously leave the door, come back 10 hours later.
And also not letting them, I always try not to say that I'm working because I need the money. You often hear a lot of that, and I don't want them to think that. I want them to do what they love to do. Although my daughter did tell me that she wanted to be a babysitter when she grows up. And I thought, maybe while you're at uni or something, but I'm not sure that's a lifelong, maybe not.
That means you're going to build like a childcare empire.
Maybe. We
kindergarten.
We need it. But I think it's, I showed her the other day, she wanted to do an invite. She was going to do it by hand. I said, well, we could use Canva. And she was a bit, I'm not sure. So I taught her how to use Canva, and all of a sudden she's a convert. She's like, wow, Mum, do you use this for work? And I was like, yep, see how? It's a plug for Canva, actually. Even an 8-year-old can use it. So.
Yeah, that's right. That's probably mostly their target audience.
Yeah.
So that's kind of how you make it work. That juggle, it sounds like, with the flexible working.
It is a juggle, but I think it comes back to, so every Sunday morning I plan, like I have a routine. Every Sunday at 9 a.m. I sort of spend an hour reflecting the last week, planning the next week. and making sure that the categories that I use, are equally balanced. So I've got my aged care startup, which is ironically AI-based digital navigation for families trying to help their parents. I've also got, Healthcare Innovated, so I have a number of clients, and that includes the course I'm developing, and then my family. So what are we doing? What do they need? Making sure we carve out time. So I think good planning is important as well.
When we first met a few weeks ago, we talked about your startup, and you introduced me to the concept of the sandwich generation, which I'd never come across. I'll confess until we met, and it definitely sent me off down a warren of research and sort of reading and learning. So there's another aspect, which is what I took away from that conversation, which is it's not just raising kids; it's also caring for the elderly or the elderliest.
Aging parents.
Sounds awful, but aging parents is I think the right phrase. Yep. And it sounds like you found yourself in that position. Yes.
I did a couple of times actually. My mum's in Tasmania and she's aging, and I've seen how hard it is. I saw how hard it was for her to navigate with my grandmother, and my grandmother ended up in a nursing home, and she didn't want to. She just, she willed herself to death. She had the most formidable life. She was such a leader in so many fields, pioneer, and then her last 2 years of life she just didn't want to be here. She didn't want to be in the home. Now, a lot of that was avoidable because, learning how to navigate home care, learning the type of support she could have had. And I'm not saying it could have been avoided altogether, but certainly I feel like there was a better way. And then helping my mum, literally no health record. I've been getting the bucket of medication and writing it all down myself and taking it to the GP, and somebody gave her a wrong medication, and then she needed some home nursing and couldn't get it, and I'm ringing my aged care, and there was just so many unknowns that I thought, again, there's got to be a better way. So that's where we've been working on Kateycares, which is literally helping focus mainly on families to say, if you want your mum and dad or family to stay in their home, these are some of the things you've got to think about. Here is how you navigate, be it funding or trying to get in front of a fall, for example. So a lot of people may have a fall, end up in hospital, and then need more urgent care. Yep. So again, trying to be a bit more preventative. If all of the customers that I've interviewed have, been, it was so overwhelming, it was a nightmare. I never want to have to deal with that again, or I'm still dealing with it and now I'm having to deal with it with Dad. And so really having a way to help people navigate with some tools and find the right solution for them.
Yeah, wow. So innovation born out of a problem you experienced firsthand.
Oh, totally. It's nobody wants to spend hours on the phone constantly, to be told no or to not understand. And a lot of the people I work with are in healthcare, and we're reasonably savvy, and we still didn't understand a lot of the needs of be it the system itself or our parents. So yeah.
And it's tough and it's stressful as well, and everything else that's happening at that time. It's emotional. It's I haven't been in that situation myself, but I'd imagine you're also quite confronting because you kind of know you're moving to a different phase of life as well at that point.
It is, and I've had to jump on a plane a couple of times because my mum lives in Tasmania, and going down there, and then sometimes I've taken my daughter with me, and then she gets concerned, why is Nanny sick, and what can we do? And then my sister has to take all of the, because she lives there, she often takes a lot of the appointments and then, working out what's what and getting frustrated. So I think a lot of families now are interstate. So they just need some way to help them, know more about it, because, knowledge is power, but only if you act on that power, of course. So giving some tools and solutions to help people in that time. And a lot of us are there. Like I'm going to 50th birthday parties all the time now. Yep. And that's a topic of conversation, parents aging, and and being stressed out by it. And, Mum wanted, the conversation last dinner party was, Mum wanted a glass of wine, but I'm her power of attorney and she's got mild dementia and I'm not quite sure whether I should let her. And it's a lot of kind of stressful things that people, just need to know a little bit more about.
Yeah, interesting. Yeah. So Kateycares?
Kateycares.
And it's a website, I'm assuming,
At the moment, yeah, we're still sort of proof of concepting, still early stages. But yeah, kateycares.com, Katey. A lot of people have said it should be Katie. But
well,
I think Katie.
Why do they think
I don't know. I think a lot of people thought it was, but no, it's Katey, Cares. And we've got a lot of information there now, but certainly a way to sign up for free around how to register for our pilot that we're going to be trialling very soon.
Lovely. What was the inspiration behind Kateycares? There a Katie?
Yeah, no, Gen X, basically. We're after Gen X name, but we wanted to make it much more empathetic. So if you think about we want it to feel like a person, right? It is a digital assistant. Yeah. It's going to be powered by a lot of knowledge and good content, and also to try and match people with the right provider as well, based on their personal needs, or even have a profile that might, be able to share a tracker with the rest of your family. So it's not always the older sister, for example, that it's often the older sister that has to do all of the work. So that's, we just wanted something that felt a bit more personal.
Yeah, great. Thank you. We're going to go to our lightning round now. So if you're familiar with this, but I'm going to ask you to take 3 cards at random. So a game of countdown.
Oh, okay.
One from the middle.
And maybe this one. There we go.
And I'm just simply going to ask you to, flip the card, read out the question and give us your answer.
All righty. What are you most proud of in your career? This is an interesting one. What am I most proud of? Probably starting Healthcare Innovated. I'd say that I did some great things at Medibank and I loved it. And I had the opportunity to come out to move into another role, and I took a leap of faith that I could build my own consultancy from scratch and help a lot more organisations, both large and small, unlock opportunity that is there, as things we've spoken about. So, I'd say Healthcare Innovated.
Yeah, I think it takes a lot of gumption to go out on your own, and a lot of backing yourself, and then to make it successful over a period of time. I think a lot of people maybe try it for a year or two and then kind of go, maybe not for me, and I'll, which is fine. I think, that's the way that we learn about ourselves. But it's a good answer.
What are the first 3 things that you check when you start your day? Interesting. So I start my day, as I mentioned, at 5:30. I actually do a meditation for 10 minutes. So that one of the things I check in that meditation is I do a bit of a gratitude. So I think it's important to start the day without checking text straight away and getting your brain going, firing. So I do a short meditation. And then I check, I have to check on my daughters and get them out of bed. And then I would say I would check my emails. Yep. Can't help that. I'm only human.
Do you? I'm just interested. Being in Melbourne, do you check the weather?
No, I don't. I should, but no, I don't check straight away. Probably do after I've got the kids' lunches and all of that done, and then I come to get dressed, and then I'll go, oh, okay, what do I need to wear? How cold is it going to be? Yeah,
interesting. It's funny when I ask people from Melbourne that question. People are either obsessed with the weather, and I'll confess that's probably me, checking it every 2 minutes. Or they just accept that you can get 4 seasons in a day, and you just dress appropriately.
Take a jacket and a scarf and sunglasses, and you're good.
That's it. Yeah, great. What have we got last?
And the last one. Oh, what's next in your career bucket list? It's launching Kateycares. So I really want to get Katie to market because I believe that she can help a lot of people. And I've seen and heard all of the struggles that people have had and how horrible it can be. So really hoping to do that.
Yeah, exciting. Couple more questions for you. Do you have any career regrets?
Career regrets. Look, the only role I didn't particularly love was probably the property role. Like that was more. It wasn't purpose fueled, and it was very much very commercially driven, and very much. It was a little bit cold, and so that was, I only did it for a year. It was a learning. It was a learning in terms of what don't I like, and that is. Trying to make as much money as possible from small providers, which is part of the reason I ended up at Shaver Shop, because I thought rather than working for Goliath, I'll go and work for David and see whether we can make a difference for some of the small guys, because the big shopping centres at the time, I'm not saying so much now, post-COVID it's been a bit of a struggle for them, but certainly pre-COVID they were doing very, very well from a lot of small providers.
Maybe flipping that question on its head a little bit, we tend to regret the things that we didn't do. Is there anything you haven't done in your career that you regret not doing?
I think if I hadn't have done if I hadn't have started Katie and being committed to that journey, I think I would have been frustrated that I hadn't gone right out on a sort of a non-consulting, a product, more product-oriented startup. I think I would have been frustrated. So that's why I'm really hoping to make it.
Well, you've certainly done a lot, so I wasn't expecting much of an answer to that question, I'll be honest. But how about feedback? During our career we get feedback. I'm always curious, what's the most significant feedback you've received?
Positive or negative? I think it's always been, I've always been very passionate, and if I've had a new idea, it's been, me trying to convince people of how good it will be and not understanding why they're not. And I think, one of my mentors, Ross, he literally did sort of pulled me aside once and said, sort of 2 ears, 1 mouth, use it in that proportion. And it was a kind of really important moment where I kind of went, you know what, I am in strategy and I do have a lot of ideas and I think they're great and I want people to hear them. And but that has helped with, I think design thinking has helped that as well, because you've really got to sit there and listen to your audience, and sometimes that won't align to what you thought. And so I think, really the art of listening and taking that on has been important.
Yeah, great. And if you were going to give sage advice to the next generation, what would it be?
I think it would be that around, no might mean not yet, and not to give up. So I think what certainly helped me in my career is grit. That kind of, things haven't always been easy, but you stay determined if it's right for you. So start with your why. Sound like Simon Sinek, but start with your why. And if that's important to you, then don't let the first no. It could be just not yet. And I always like to say things ripen, and things take time to ripen. And I've been in many strategy roles where I've done a piece of work and then it's taken 2 or 3 years later that I've seen it in come to life, and I'm kind of like, oh, that did happen. But at the time, you want to see it happen, but you've got to let it ripen.
Are you a patient person?
Not really. I think the older you get, the more patient you become, because you kind of realise that the world doesn't revolve around you and your ideas. So you've got to be patient. Yeah,
great. I normally ask people for a sort of book recommendation, but I feel like we share a library. But I'm just curious, what have you read recently that's really stood out?
The Human Element actually is what I'm reading at the moment. I love reading. I do a lot of audio books mainly, drives and during laundry and all of that stuff. So The Human Element, I can't think who wrote it, but that is a good one. And also for those who love innovation, Uri Levine, founder of Waze.com, wrote a book called Fall in Love with the Problem, Not the Solution. It's a very good book.
It's my favourite quote. I must have, I didn't know the source, but I think
Uri
I've just
Levine.
learned it.
Yeah. So, it's really good.
Yeah, amazing. How about podcasts, apart from Tech Titans? What do you listen to?
Obviously yours. Podcasts, I can't get away from Malcolm Gladwell, Revisionist History. Revisionist History. I just love Malcolm, and his ways. So I love that. It's probably it.
Have you? I also love Malcolm Gladwell, and have you read his rethink of Tipping Point?
No, I haven't.
Is it Tipping Point? I'm sure it's the. No, I'm getting myself confused. Maybe it is. He's anyway. He's done a rethink 30 years on from the original.
Oh, I'll have to get onto that.
Tipping Point, because he talks about COVID and what we've learned sort of about the COVID and other things, which is really interesting. There's also a couple of great episodes where him and Adam Grant.
Oh, I love Adam Grant too.
So he'll unpack some of their ideas, and then they will have a healthy debate. And they'll disagree on intentionally about some ideas. Yeah. And those two on stage together are pretty powerful.
Yeah, I can imagine. So, I've seen Malcolm on stage. He was great.
When he came to Melbourne? We did a team incentive actually to go to Malcolm Gladwell, Adam Grant, which was...
I didn't see Adam. I saw Malcolm. It was a number of years ago. So,
Yeah, so there you go. Look, thank you so much for your time. Thank you for, I know you've had a really long day today. We've been running workshops and we've got you right in the day, and we're in a very, very hot room as well.
It is quite warm in here.
I think I'm losing my voice, but awesome. We've had maybe 2 or 3 conversations, and every time I learn something really interesting from you. So thank you for sharing.
No, thank you. Keep up the good work.
Thanks.
Fighting the good fight, as I like to say.
Cheers.
Thanks.
Thank you for listening to Tales from Tech Titans, and be sure to follow us wherever you get your podcast. If you'd like to get more insights about tech careers, then check out the Ember, that's EMMBR LinkedIn page for the latest updates, articles, and engaging discussions.